Which of the following is the most common site for dual-site ECMO drainage cannulation? A. Left subclavian vein. B. Right internal jugular vein. C. Femoral artery. D. Femoral vein. Answer: D. Femoral vein. Explanation: in standard two-site ECMO, the femoral vein is typically used for drainage, pulling blood from the IVC, while the right internal jugular vein is used for the return cannula, sending blood toward the tricuspid valve. During ECMO weaning, the pulse pressure on the arterial line begins to widen. What does this usually signify? A. The ECMO pump is failing. B. Increasing left ventricular, LV, stroke volume and cardiac recovery. C. The patient is becoming increasingly septic. D. Severe aortic regurgitation. Answer: B. Increasing left ventricular, LV, stroke volume and cardiac recovery. Explanation: on ECMO, the flow is often continuous, which narrows the pulse pressure. As the heart recovers and contributes more to the total cardiac output, the difference between systolic and diastolic pressure, pulse pressure, increases. What is the MIVC or pigtail cannula specifically designed to reduce during ECMO? A. Hemolysis. B. Recirculation. C. Infection rates. D. Arterial dissection. Answer: B. Recirculation. Explanation: specialized cannulae, like the dual-lumen or multi-stage drainage cannulae, are designed to optimize the distance between the drainage and return ports to minimize the resuctioning of oxygenated blood, recirculation. During weaning from ECMO, which medication class is often titrated up as ECMO flow is titrated down? A. Sedatives. B. Inotropes, e.g., milrinone or dobutamine. C. Paralytics. D. Loop diuretics. Answer: B. Inotropes, e.g., milrinone or dobutamine. Explanation: as mechanical support from the ECMO pump is withdrawn, pharmacological support, inotropes, may be needed to assist the recovering myocardium in maintaining adequate systemic perfusion. A chattering or kicking of the venous drainage line during the early stages of cannulation usually indicates: A. The pump speed, RPM, is too low. B. The patient is fluid overloaded. C. Inadequate venous return, hypovolemia or cannula malposition. D. The oxygenator is failing. Answer: C. Inadequate venous return, hypovolemia or cannula malposition. Explanation: line chattering occurs when the pump is trying to pull more blood than the vein is providing, causing the vein wall to intermittently collapse against the cannula ports. In ECMO weaning, what is the significance of the trial off lasting 1 to 4 hours? A. To see if the patient develops a fever. B. To ensure the patient can maintain stable blood gases, PAO2/PACO2, over a sustained period of metabolic activity. C. To allow the heparin to wear off naturally. D. To test the strength of the arterial sutures. Answer: B. To ensure the patient can maintain stable blood gases, PAO2/PACO2, over a sustained period of metabolic activity. Explanation: a brief trial might not reveal the gradual rise in CO2 or drop in O2 that occurs as the patient's intrinsic lung function is taxed over time. Which anatomical landmark is used to guide the insertion of a femoral arterial cannula? A. 1 cm above the inguinal ligament. B. 1 to 2 cm below the inguinal ligament, common femoral artery. C. The midshaft of the femur. D. The popliteal fossa. Answer: B. 1 to 2 cm below the inguinal ligament, common femoral artery. Explanation: cannulating above the inguinal ligament increases the risk of retroperitoneal hemorrhage, which is difficult to compress and can be fatal. What is the primary risk of abrupt decannulation in ECMO without a trial? A. Sudden increase in lung compliance. B. Acute left ventricular failure and pulmonary edema. C. Hyperventilation. D. Immediate renal failure. Answer: B. Acute left ventricular failure and pulmonary edema. Explanation: the heart may not be ready to handle the full systemic vascular resistance, afterload, and volume, preload, without the pump's assistance. This can lead to instant cardiac stunning and failure. When using a surgical cut-down for weaning/decannulation of a VA-ECMO arterial site, the surgeon must perform A. A fasciotomy. B. A primary repair of the arteriotomy. C. A permanent ligation of the artery. D. A skin graft. Answer: B. A primary repair of the arteriotomy. Explanation: because the arterial cannulae are large, the hole left behind, arteriotomy, often requires surgical suturing to ensure the vessel remains patent and does not leak, unlike venous sites which may sometimes be managed with manual pressure. Which parameter is the most sensitive for detecting recirculation during VV-ECMO management? A. High premembrane pressure. B. Low SpO2, venous oxygen saturation, in the patient. C. High SpO2, oxygen saturation of the blood entering the ECMO circuit. D. Decreased urine output. Answer: C. High SpO2, oxygen saturation of the blood entering the ECMO circuit. Explanation: if the blood coming into the ECMO machine is already highly oxygenated, e.g., greater than 80%, it means the machine is just sucking back the blood it just cleaned, rather than pulling deoxygenated blood from the patient's systemic circulation.